Hello, good morning. We are joining you from Spokane Regional Health District for Facebook Live. I'm Kelly Hawkins. I'm the Director of Public Information and Government Affairs. And today I'm trading places with our health officer, Dr. Velasquez. I'll be asking him some questions about vaccine updates as we enter the respiratory illness season. And it's respiratory illness season because as the temperatures get colder, we're inside more, we're trading germs more, flu, RSV, pertussis, COVID. So what do you think? How do people know when all these diseases are kind of filtering around?
Sure.
How do they know what vaccine they and their families should and could be receiving?
So good question. And respiratory illness season comes around the same time every year, but, September-ish through the winter months. So once we start to think about Halloween, we need to start thinking about vaccines. Actually, that rhymes. We should say that. But now we do have all of the respiratory illnesses. We actually have had cases in the community already, and flu will be coming around pretty soon. So the first thing you should do is make sure that your provider is aware of what immunizations, vaccines you have or need. So it varies by provider. Like my provider has already sent me some alerts, like you are due for or make sure you get your, but not every provider does that. So talk to your primary care provider. It could be a PA, an MP, a doctor, a pediatrician, depending on the age. And if that doesn't work or you don't have one, the Department of Health website has a lot of information about all of the vaccines that are appropriate at this point in time. And I know we're going to be flashing some of that information. And last but not least, every neighborhood, every street, every block has your friendly pharmacist that can actually tell you what you may need and help you with the appropriate selection.
And you mentioned around Halloween, is there a space of time when people should be getting vaccines or a deadline when they should be getting them by in order to know
Sure.
they're most effective?
So what I always recommend is if ideally get it in October early, at a minimum 2 weeks before Halloween, so you can go trick or treating and because remember that it takes a little bit to build that immunity. So you don't get it on the 30th and then go trick or treating on the 31st because you're not going to be protected. But so ideally, that's what I tell everybody because it's easy to remember. But if you cannot, for whatever reasons, as soon as possible within this month would be great, or a little bit later if you cannot do it now. And always talk to your provider who will be able to guide you the best time to do it for yourself. But my advice for the most part is get your vaccine before Halloween, like your flu shot, and then you can go trick or treating safely.
But if you don't by Halloween, it's never too late.
Never
right?
too late.
Never
You
too
can
late.
always get it. Just make sure that you don't wait until June of next
Right.
year, because by then respiratory illness season will have gone away.
So you shared where we can go to get more information and learn what we need to get, when we should be getting it by, but what are some barriers that might keep people from being able to get access to the vaccines?
Sure. So good question. So at this time of the year, not every provider has received their vaccine allocation. So it varies by provider, it varies by clinic. So make sure you've checked with them because supply chain at this time of the year can be a little bit more complicated. Everybody's asking, everybody's ordering, so there may be some delays. That's number one. Another area that we have heard about is some pharmacies are requiring prescriptions, which is appropriate, and prescriptions are required for a lot of things. But if you don't have one or you don't know where to get one, in the state of Washington, we have a standing order that was released at the request of, or on the authority of the Secretary of Health, which Secretary of Health can do, that allows you to go print that. Is signed by our chief medical officer for the state, and you can go to the pharmacy, and that is actually an order, prescription order, that allows you to get, for example, COVID vaccines. And people will say, so what's a standing order? Somebody standing there? No. A standing order is something that we do to cover either a person or a group of people to make sure that they have access to, could be vaccines, it could be other like tests, for example. And in this particular case, a group of people is anyone in the state of Washington that needs access to vaccines.
And the cost tends to be a concern with people? Where should people go to maybe have more resources that can help them with the cost of vaccines, especially when working with their insurance companies?
Right. So that's a great question because we do know, medical costs can be a concern for many, and we should always be aware of what the coverage is from our provider. And the reason why I say that is every carrier has different rules and different either restrictions and or coverages. So first go to your insurance company. And most insurance companies have a website. You can go and check, like, am I covered for? And it will answer. If you cannot find it, the Insurance Commission of the state of Washington has all of that information readily available if you go to the website and check it. But don't assume that it's covered. Don't assume what your copay is. It's always good to check before you do. This is the time of the year that a lot of us start to do a little bit more of the routine maintenance. So make sure that everything you need, including all your vaccines, are covered, and know what your copay is, if any.
Great, thank you so much. I think this was really helping us get prepared to try and be healthy throughout the winter months. All of the information that was shared here today is in links within this video, so please check them out. And we also have a clinic coming up. It's at the Raise Early Learning and Development Center. It's, what's the date of it? Do we know?
October the 11th.
Oh, good. October the 11th.
It's coming up.
So check that out. You can see that on srhd.org in our events section. And yes, so stay healthy, and we look forward to seeing you next week for Facebook Live.
And actually, glad you mentioned the clinic is open for adults and children.
Oh, okay.
And the Raise Early Learning and Development Center is nearby Holy Family. If you're not familiar with it, it's right there, very accessible. And the team will be there October the 11th. So come and join us.
Great. All right. Well, thank you, and thanks for joining us.
Have a great day. Thank you.